Andy Smith. I'm Professor of Psychology, School of Psychology, Cardiff University, and Director, Centre for Occupational and Health Psychology. I started research with Donald Broadbent at Oxford studying the effects of noise, and after that I moved to Sussex University and studied circadian rhythms and fatigue in the workplace. I came to Cardiff in 1990 and carried out a range of projects on stress, fatigue, cognitive function and health-related behaviours. And I moved to Bristol in 1993 and returned to Cardiff in 1999, and I've been here since then. My research covers a number of topics, but they can be categorised in terms of two main themes. Looking first of all at factors which affect people's health, such as stress and working conditions, and then secondly looking at the impact of these factors on people's cognitive function and their well-being. I started my research looking at the effects of noise, and it's interesting that many years later we're still studying the effects of noise, and I'm in charge of a sub-project of a European project called ENA, which is looking at new approaches to the effects of noise. And so we're suggesting methodologies that have been used in other areas that can now be applied to understanding the effects of noise on health and cognitive function. Another area where I'm continuing to work after many years is looking at stress in the workplace, and also turning the area around to try and look at positives rather than negatives. So one of the questions that we've been trying to address in our recent research is what makes a good job, and here we've been looking at the positive features of working and how they give people a sense of well-being, which in turn may have long-term consequences for their health. There have been two main themes. One has been looking at how a person's psychological characteristics influence their susceptibility to getting colds. So, for example, we've shown that people who are stressed are more likely to get colds and flu. And the other is looking at the behavioural effects of having a minor illness. And again, we've shown that people's mood and their performance efficiency is impaired when they have a cold, and this may have a consequence for their productivity and safety at work and carrying out other everyday activities. This research started in an attempt to come up with methods that could get rid of some of the negative effects of being fatigued. And what we were able to show is that when people have a lower level of alertness than they'd like, so for example when they're working at night or when they've been sleep deprived, then a good way to counteract this is by getting them to consume caffeinated drinks. And we've extended this area to look at caffeine in many forms, one of the latest being looking at beneficial effects of caffeine in chewing gum. A lot of the research that I've carried out has looked at generic topics which can be applied to a wide range of occupations. One occupation that we've recently studied has been seafaring, and this has been a very interesting area to look at, because seafarers are exposed to a combination of many different potential hazards, and so this brings together a lot of the research we've got in one particular context. So seafarers have very fatiguing jobs due to long working hours, poor weather conditions, exposure to noise, and it's inappropriate to look at any of those issues in isolation. Similarly, one's interested in a number of different outcomes, both health-related outcomes and performance-related outcomes, which may have an impact on safety at sea. And this project has looked at many of the general factors that I've described in my other projects, but there are also specific problems associated with being a seafarer, and I think that what we've done is come up with both a description of these and recommendations which can influence policy and practice. There are three main approaches that I like to adopt. One, I've clearly worked in a lot of different areas, and most of those require some finishing off in terms of dotting the I's and crossing the T's. So I'd certainly like to complete a number of areas which I've been working on for many, many years. The second one is to take the approaches I've used for many years and apply those to new topics. And these are always things which are coming up. If one takes an area like nutrition and behaviour, there's always a need to investigate new products, and sometimes even well-studied products require further investigation. So for many years we had very little interest in caffeine in children because children didn't consume very much caffeine, but now with high caffeinated energy drinks this is becoming a topic of concern. The other one, of course, is to extend the methods that one uses, and we used a variety of methods, subjective reports to questionnaires, objective measures of performance, and even physiological markers of some of the effects. And this is clearly an area which is growing, brain imaging, looking at genetic susceptibility. These are all methods which I think will be applied to some of the areas that have been widely studied in the past.